Some of those compelling dramas in film and television are about medicine. Stories of doctors and patients, ERs and hospitals. Down through history, the doctor's always been the hero. In this particular case, though, new media medicine is about not changing the plot or changing the story particularly, or even changing the cast. It's about changing the entire frame. And the star of these new stories in new media medicine are the patients. Certainly, medicine is no stranger to technology, but it's curious the places in which technology hasn't even been tried. What are some of those?
Technology has made a tremendous difference in how we discover drugs, for example. It's made a tremendous difference in devices, medical devices and so forth. But it really hasn't changed the fundamental relationship between the physician, between his or her patient, between the community as itself. All it's done is made communications perhaps easier. But how will technology really enable patients to participate at their fullest possible potential in their own care? How do we tap into this, capability of people? Technology has not yet taken that optimistic view and unleashed the power of patients to truly participate fully in their own care, the care of their loved ones. And that's the area that we really have to focus on.
What is the giant unexploited resource in medical research from your perspective?
I think there are two primary resources. One is the information about everyday life that every patient has that's unrecorded. And the second is the intuitions and experiences of that life data that every patient has. So the long-term vision is we're looking at a different kind of scientific paradigm, a data-driven collective discovery process that allows a set of patients, any one of whom may not have a lot of methodological rigor, but mediated by interaction with the computer, we can actually form sound hypotheses and actually provide sound data to support them.
So John, you're already a doctor. Why haven't you fixed this problem?
Well, it's a huge problem, and unfortunately, I think that the situation is such that we're working in completely the wrong direction. So that's why I left practicing medicine, because I think that continuing with this incremental change is just leading us on the wrong path.
All right, let me give you an experience that's probably familiar to you. I come into the office, some nurses come, they poke me, they do this, they take some data, I give them a sample maybe of this and that, some stuff gets written down, then I go see the doctor in this other room, the doctor goes, and then he gives me some orders, and I leave, and I get a bill. How would that be different under your plan?
The idea is that when that data gets put in the system, it's right there visualized for the patient. And we try and visualize it in a way that's meaningful to them so that I can look at it with them and say, well, this is what I'm thinking about this. And this is why I think we need to take this piece of action.
And the rest of the time, it's in high-quality interactions over these digital connections.
Exactly.
All right, Clark, so explain to me what you've got here. I suspect this is a little more global.
The idea is to send out a web crawler which collects news reports from around the world, from online news sources, about disease outbreaks.
What relationship do you think changes most radically if this reaches the vision that you imagine for it? What healthcare relationship changes most radically?
Probably the biggest thing is the relationship of the government to the citizens, to the community, and so to be able to respond more quickly, to contain outbreaks while it's still easy to do that. At the clinical level, though, it also has the potential to have an impact, because if you have ongoing reports of, let's say, there's been outbreaks of meningitis in your area, then that can serve to help you inform your diagnostic decision as you see patients coming in.
Information is a safety net.
Right.
How radically do you think the healthcare domain is going to change when some of the things that you envision actually make it?
I imagine a future when a patient walks into a doctor's office and the doctor and the patient see all the same information there as you see on a call with your insurance agent, or you see when you're trying to make your own medical decisions, or when you're talking to a family member. And that transparency, I think, is probably the most transformative opportunity in healthcare.
What's the indicator for some time in the future where this technology is actually a part of the doctor-patient experience? You would imagine that patients would say, what reaction do you think they would have to this that would say to you, we've gotten somewhere?
When they say, this is amazing, I can see what's going on with me, and I can interact. I can change that. And I can come to my doctor and say, look at what I'm doing. Can you help me? Right? Rather than say, I have a problem. Tell me what to do.
So I guess you'll know that things are starting to change when patients stop saying what he or she told me to do,
right,
and move to what we are doing to achieve this goal.
Very much so.